bottom. Science.
Mr. Kanda?
Yes.
It is not 3 o'clock where most of us are.
Well, wait a minute. It's 1 o'clock. Forgot where I was. I was looking at my phone. It's 1 p.m. Mountain Time. I appreciate it.
Yeah, that's true. I hope it's not 3. I got another call to be on.
Yeah, I know it. All right, so let's call the meeting to order. And Kelly, why don't you do the roll call of the board and the health department, and then we'll have people that I'll mention who I know's on, and then we'll have everybody report in. So go ahead, Kelly.
Bill Kanda.
Here.
Tom Flower.
Here.
Jay Prince.
Here.
Attorney Clint Smith.
I'll text him real quick.
Okay. And Public Health Director Alyssa Livengood.
Here.
Okay. And Kelly, are you here?
Yes, Kelly is here.
All right. I also know that Ron and company is on. Did you get that, Kelly?
Yes.
And Guinevere's on. And other than that, I have nobody. So let each person take their time down. And Kelly, once you get the name written down, ask for another one. So take it away, somebody.
Meredith's on.
Clint's here.
$50.
Clint's here, I heard, but then that interrupted somebody. Go ahead.
Tracy Ballard, the Valley Beat, contributor for the Sentinel.
Diane Rose. Meredith Nichols, emergency manager for Custer County. Eileen Silvercliff, town clerk, and Buck Winslow, mayor, is in the parking lot.
Okay.
Elliot Jackson, Wet Mountain Tribune.
Anybody else?
Diane Rose.
Go ahead.
Custer County Fair Board.
Marlon Gonzalez, Custer County Fair Board.
Brianna Evers, Fair Board.
Anybody else? Did you catch them all, Kelly?
Yep, I sure did.
All right, and we'll roll down the agenda. Next is the amend agenda. Anybody, Tom? Amend agenda?
I do have.
Go ahead.
I would move that we separate the last item, consideration of fair and rodeo, and consider those in 2 separate agenda items.
Yeah, I was going to bring that up. That's true. Those are 2 separate issues. Second it. Okay, it's moved in second. Let's separate the 2 items at the bottom. We'll separate the fair. Somebody's in the wind. Yes, Island.
If we could move, unless you're speaking, I'd really appreciate it. I'm having a hard time hearing.
Okay, I don't hear it now. Okay, so it's been moved in second. We'll separate those into 2 topics.
Bill, I never heard who the second was on that.
It was me.
Thank you.
Okay, Jay? Vote.
Oh, I'm sorry. Yes. I vote yes. Aye.
Okay, Tom?
Aye.
Aye from here, so let's separate the 2. We'll do the fair board first. Okay. Any other amendments, Jay?
I have nothing else, sir.
Okay, nor do I. All right, report from the board members. Jay, do you have anything to bring up? Excuse me. Wait a minute. I'm sorry. I don't think we had the minutes. Did we have a set of minutes, Kelly?
Yeah, we did. I think
I saw something, but I couldn't find it.
Yeah, I think it was from the 4th. Let me look.
And you sent them out, right? I didn't.
Yes.
I couldn't pick them up.
Yeah, I sent them out. It was from the 14th.
Sure, I read them. I thought they were good. In fact, I'll go ahead and move that we approve the minutes for May 14th, 2020.
I'll second it.
Okay, it's been moved and seconded that we approve the minutes. I did read them the first time I got it, but I could not pick them up. I may have deleted the email by mistake. But anyway, it's been moved and seconded. Approve the minutes. Jay?
I vote aye.
Tom?
Aye.
And I also accept the minutes as they are. Okay. Now let's hear. Jay, you've got something to report on?
Well, I have a concern about a couple of items that are really not on the agenda, and maybe it's not even appropriate to bring up because they're not agenda items. But the first is, having these rules. First of all, I really need to understand, are these enforceable orders that are out, or are these suggestions based in public and that type of thing? And depending on the answer to that, if they're enforceable, who's responsible for enforcing these? It sounds to me like it ought to be a police action, although when I brought it up yesterday, I was told that really the public health director is the one who would write some of the citation if that's the case. And I'm thinking, just from walking around, it looks to me like compliance is lackadaisical at best, and maybe if this is enforceable, we ought to start thinking about why do we have the rules if we're not going to enforce them. So this is just some comments I have just in general for the safety of our community.
So are you suggesting that we have a discussion on that toward the end?
Yeah, I'd like to have some answers as to, are these suggestions, or do the suggestions have teeth to them? Is there an ordinance or some other mechanism? And then that's part A. And part B is, if it's enforceable, who is the correct entity to do the enforcement?
Right. Okay, so let's do that. Let's wait until after we get through the agenda items. I think that's a good one. I also have a comment on that as well, because I was asked by some citizens and their businesses some of the process here, and we can bring that up at the same time because it fits. If that's okay.
Sounds good.
Sounds okay.
I'm fine with that.
You got anything else, Jay?
No, that's all I have.
Tom?
Nothing.
Okay. All right. We'll do that. That's a good point. Alyssa, we need a report from you, kind of a status of where we are with the big picture, and then if you have anything else.
Sure. Thank you. So I'd like to start with a case count. Right now we have 21 negative cases. The original 2 positive cases, which have now tested negative, and 2 pending tests. So we should have those results. Should have 1 back by tomorrow. The next one should be back by Friday.
Okay.
Quick question.
Go ahead, Tom.
Quick question. So, Alyssa, you said that they're not testing positive, or negative. Did you retest the 2 that did come up positive?
They were retested, yes.
Okay, thank you. I didn't know that. Perfect.
Yeah. In fact, the gentleman who was in the hospital for so long is supposed to come home tomorrow, and he's actually tested negative twice. So.
How wonderful.
yeah,
great.
it's fantastic. So he's still going to have a lot of rehab to do at home, but and he'll be on oxygen at the altitude, of course, but he has recovered quite nicely considering where he was at for so long. So it's encouraging. So our waiver has been accepted, as everyone...
One really quick question, Alyssa, before you move on to your report.
Sure.
On the negatives, are you getting requests from people or through a doctor? How are you picking up the requirement to test somebody?
Sure. So in Custer County, we're just testing anybody that has symptoms or has a note from the doctor. At this point, we have about 60 tests. So I'm being pretty liberal at this point with reports of symptoms. You know, if somebody says, well, I just don't have any symptoms at all, but I'm curious if I have it, we're not testing those people. But if they say they have any kind of symptoms at all, fever, cough, shortness of breath especially, I'll test them. So, and it doesn't cost the county or the patient anything to be tested at this point. So
that's great. I was asked that question, and that's good to know, and I'm glad the papers are on and people are here to hear that, so that they are available. You have 60 additional tests left.
We do, yeah. And we should have 50 more coming, but I don't know. I need to talk to Shannon about that. Because honestly, I think we might try to cancel that order and see if we can get a refund for those 50 additional tests that we haven't received yet, because we can get tests for free from the state now. They're telling us as many as we want, so we'll see when the rubber meets the road with that, whether we actually can get them or not. But
that's a good idea to cancel them. Is it costly?
Yeah, they're like $12 a test, the ones we bought, that we ordered like the first week of April.
Okay, we can discuss that too at the end then, probably. I'll think about that. Okay, so go ahead. Well, go ahead now. I'm sorry to have interrupted you.
Okay, no worries. Thank you. Okay, so as everybody knows, we received the waiver, and I'm going to speak a little bit to Jay's question right now, and then we can discuss it again later, of course. But the variance, we've been calling it a waiver. The state calls it a variance. Go ahead, Jay.
That was just a noise.
Oh, okay. Sorry. Okay, so we put, of course, you all saw that what we actually submitted for our variance, and what we got back was very close, but not exactly the same as what we had submitted. So a few things that are different is that, or maybe not different, but just something that I want to reiterate, is that employees shall wear face coverings. Well, it says face coverings shall be worn by all employees at all times. So that's under the reviewing business plans to reopen. So that's everybody. That's every business. If you are in contact with people in your business, you need to have a face mask on. And it needs to cover both your mouth and your nose, or else you're not doing anybody any good. As far as the customers and the people in the general population wearing a mask?
Can you hold just a second and take it one step at a time to make it clear so that people aren't confused? So is that a state order or is that a county order?
That's a state order.
Okay, that's very, very clear. That's a state requirement, and to Jay's point, that is, if it's an order, it's enforceable. Correct?
Correct. Yes.
Okay. Now the next one, customers.
So customers, it's just stated that they're strongly suggested to wear face masks, which does not mean it's mandated, so that is not enforceable.
Okay. Okay. And
so let me expand on that just one more step, though. It does say under the restaurant element that it requires customers to wear face coverings in order to enter the business and keep them on until they've reached their table, and which time they can take them off.
Is that a guideline or an order?
That's an order. That's in the variance as an order.
Good. Okay.
And so the rest of the variance speaks to gyms, restaurants, of course, not having bars open, and houses of worship. So does anybody have questions, I guess, on any of those that they've seen so far?
Okay, I will bring up one, and I was going to wait to the end, but it fits right here in your discussion. I had a business call and ask. They had not been contacted, or they hadn't even tried to contact you all yet either, and they were under the assumption that if they did curbside only and not let people in, that the employee requirement wasn't part of the requirement. So how are you treating that? If a business decides not to let people in, even though they can, are the employees required to have a mask while they're inside?
They are. They're still required. I mean, under this, it says all all employees, face coverings shall be worn by all employees at all times. Now, I understand that it's difficult to wear a mask for 8 hours. I've done it a lot of years in my career, and I get that. So, that's the order, and that's what we're going off of. Now, if I see somebody step away from the customers and take their mask off so they can get a breath of air, I'm not going to write them a ticket for that. I think we need to use a little bit of common sense when it comes to things like that. But if I see people with, that are serving other people food or any other thing, for that matter, we're going to have a discussion. And so moving into the next thing I was going to talk about there is that, obviously we're getting, literally my phone is blowing up all day long and most of the evening with people saying so-and-so's not wearing a mask, so-and-so's not wearing a mask, or it's unhealthy to wear a mask the whole time they're at work, blah, blah, blah. So I get both sides of it. That being said, it's still the order to wear a mask, and everyone knows that has gotten a certificate of compliance from us. And it's written in their plan, or they wouldn't have gotten a certificate of compliance. So to say they didn't know doesn't cut it with me. Sorry. So those people, I put out 5 letters today, a written letter from Public Health stating all the rules, exactly what the orders are, along with a copy of this variance, and stating that if you have to be contacted again, you will receive a $1,000 fine.
Good. Okay, so that's the second part of my question. Same business, and I'll mention the business. It's Sugar Lump. Jolly F asked the question. She had not. I asked her if she had a certificate. She said she had not. Didn't know. It had never been in contact either way. So
no, she has a certificate.
Well, she told me she did just a few minutes ago. So
Right.
if she does, that's okay. I was going to just ask if you would work with her so that she knows what compliance is, and I did state exactly what you just pointed out. And I think she's willing to work. She just told me that they bought the place in February, and then all of a sudden all this happened. So if you've given her the certificate, or you've given her the guidance on how to get the certificate, or does she actually have a certificate in her possession now?
I'll have to look through my stuff, but I'm almost positive that she has it in her possession.
Well, please do that, because she claims that if she would have talked to you, she would have known better. But anyway, I suggest just a good conversation.
Okay. Well, I had a conversation with her this morning, and also she received a letter this morning, so she should be well informed now.
Okay. She knows has she been inspected? Does she know if she showed you the procedure she's had so that she can, you agree with whatever she's talked to you about if she has a certificate. Is that correct?
Correct. Yes.
Okay. All right, good. Okay. Anything else?
I just want to expand on that just a little bit, in that my goal here is not to be a pain in the butt and make it hard for businesses to provide their service. I really just am trying to follow the orders the best we can, and keep this community safe. And I want everyone to understand that we are not out of the woods. Just because we have only had 2 cases and we currently really have 0 cases unless one of these 2 comes back, it does not mean we're out of the woods. We still have people coming up here from places that have a high count. And as we can see, walking down the street, people are not being compliant about wearing masks. So by no means are we out of the woods. And the more we start opening up and the more events we have, the higher our risk goes. So I just want to voice that right now. So that's all I have for now.
Okay, let's follow up on that because that's a very good point. It's important for everybody to know that you and the health department are working hand in glove with everybody, more than happy to help them come into compliance and answer any questions. And I got another odd question from another outfit. If they are a family eating in a restaurant and a family member stands up to take a picture without a mask because they're sitting at their table together, are they in trouble? So I just responded and said, that's case by case, and I'm sure that there's many cases where you would have exceptions for people that might brush by people, and I think there's a paranoia going on that people would see something like that and then report them, and it might be an unfair report, but that's something you would work out with them real time, right? I mean, you all are willing to work with whoever. It's important. Right?
Sure. So a couple of things about that. First of all, common sense goes a long ways, and I realize that it's lost on many, but if you're standing up to take a picture and you're not standing within 6 feet of anybody else, I think you should be totally fine. If you have to stand next to somebody else's table to do that, you probably shouldn't be taking the picture in the first place. Right. Be respectful of other people's space and, use a little bit of common sense. And then the other thing, again, I want to work with everybody, and just because somebody calls and tattles doesn't mean that that person that's been reported is automatically going to get a letter or a ticket. I'm going to first have a conversation with them, and then if I get another complaint or I see it with my own eyes, I'm going to write a letter. I am not going to write a ticket ever unless I see it with my own eyes. So I will not be issuing tickets on tattletales ever. So I want that to be clear too.
That's very good. That's why we brought it up. Excellent. Comments? Anybody else? Tom? Jay?
No. No, that explains a lot to me, and I appreciate that explanation. Thank you.
Okay, good. Melissa, any other comments?
I don't have anything else right now.
Meredith, do you have anything from a command point of view? Meredith on?
She is. Hang on just a sec. She does. Give us just a second. Somebody walked in and talked to her. She's getting out of it.
Okay, give her a second here, guys. She has a customer, does she, Hillis?
She does, yeah, but Rhonda's back now, so she's going to take over. I don't know what happened exactly. Sorry.
Sorry, guys, I was filling a question from Alpine. Sorry. Hear me?
Good.
Okay, so I think, so we transitioned from an EOC, Emergency Operations Center, into an ROC, Recovery Operations Center, and that includes still within our operations. So just like Alyssa said, we're not out of the woods, but we are looking for plans moving forward. So whenever we are, we can be ready for that. And so there's still a functionality within the Recovery Operations Center for operations, which include addressing the complaints, reviewing business plans, and verifying the plans with site visits, and also just supporting the businesses and making sure that they have the support they need to function within these waivers and public health orders. We're not just leaving people high and dry. We are working with them and to support them the best that we can to make sure that they have the resources and information to function within these waivers. Another functionality within the Recovery Operations Center is the Recovery Task Force now functioning within that. And so that streamlines communication. It creates a little bit more of a structure, and it supports the Recovery Task Force, I think, a little bit stronger so that they can function and do the things that they need to do within the support of the Recovery Operations Center. Now, also a function within that is the planning section, which I will be lead on, and that is how, within Melissa as well, but how we're going to plan for special events if and when they fall into the variance or the waiver that we get. That would include how we're going to function within the rodeo, if that's a possibility, how parades will function, and just special events. Just the mentality of them wanting to happen is fine, but also, and the plan, great. You have a plan, perfect. How is it going to be executed? Who are your players? You say that you're going to have, wellness checks. Okay, how and who and where? Things like that within their plans, and we want to be able to support, but also we don't have a lot of manpower, and so working with the Unified Command and Public Health is great, but we can't create plans for you, and so function within that. I think that should be a discussion item along the way, especially, it would be part of the discussion, I'm sure, with the rodeo. Yeah, that's kind of the status that we're at right now, if there's any questions.
Okay, so this is good. This is a very good point to bring up now for public comment. We've touched on the waiver status. Are there any questions about anything you've heard so far from a public point of view? And Meredith brought up a point that we probably ought to discuss. We will get into that with two special events. That would be the fair and the rodeo. But any comments publicly from anybody?
Yeah, Bill, Ron Beckner. Meredith, I'm really glad to hear, you say that as a recovery operations center that you're looking at supporting businesses and providing resources and people, because that's exactly what we're looking for. So thank you for that. We know that everybody in this county is going to be limited, and I think that's why, having the vision of it's going to take a village, and anybody and everybody that can help and participate is going to be the only way to make these things happen and happen in a healthy, safe manner. Thank you.
That's a good point. Thanks, Ron. I think everybody, rather than looking at it as tattletaling, we need to help each other if we're having problems, my view. Some good points. Any other public comments? Anybody? Okay, well, who's the waiver status? We'll get into new business. Is there anything else now, Alyssa, to bring up waiver status-wise? We need to understand when the waiver expires, if it does expire, and what we think the next phase is going to be, and are we ready for phase 2 and 3, that kind of thing. So take it away.
That's a great point, Bill. Thanks for bringing that up. So first I want to tell you that the waiver or the variance that we have, that we have now is good until the 26th, which is next Tuesday. The reason it's only good till the 26th is because that's when the governor's supposed to come out with new orders and guidelines. So at that point, if what the governor comes out with is more strict than what our variance already states, our variance will stay in effect. If it's less strict than what our variance states, then we'll obviously just go into the to that phase, yeah. And again, okay, so then let's talk about phases. We're going to move out away from using the word phase. I think we're going to, that was our initial thought, but it was clear when we got our variance request back that phases are not a thing really of the state. And you'll hear some of that verbiage with the state still, but the thing is that it's really more of what the next steps are rather than next phase. So here's the thing. If the governor comes out with, okay, we can have 25 people gathered together, then we as a Board of Health have to decide if we're okay with 25 people or if we want to write another variance for 50 people or whatever the next step is that we want. Does that make sense?
Yes, we could go, what you're saying is we could ask for more, what do you call it, a variance, not a variance, but a waiver. Well, I guess it's a variance, right?
It is a variance, yeah. Yeah, so we will have to reapply for a variance if we say we wanted it to be 50 people and the governor said it was 25 or whatever. If we want it to be less than what the governor says and less than what our current waiver says, less being, less strict, then we have to apply for another variance.
Okay, good. Along that line, let me ask a question. Is there any business in the county that isn't covered in our variance? Can we open up every business we have to some degree?
Yes. To some degree, yes. People either fall under essential businesses, which are the ones that have been open all along, the grocery store, the dollar stores, construction, outdoor stuff like that. And then now with the variants that we have, restaurants, gyms, houses of worship, and what's the other thing, Meredith, I'm missing?
Gyms and fitness centers?
Gyms, yeah. Those are all under, so I guess I kind of lied because the one thing that is not able to open is bars. So we only have one bar, really, the Dome, and they can still serve pizza, just not liquor at the bar. So, but all of our, go ahead.
They could serve liquor in the restaurant, but not at the bar.
Yes.
Okay.
Yeah, bar seating is not allowed, whether in a restaurant or an actual bar.
And that's a state order, not a...
Well, no, that was part of our waiver. So even whenever we sent in the waiver request initially, we said no bars or no bar seating was allowed within our first, and they agreed to that.
Right, but I thought the state, maybe I misunderstood what the state law or what the state order came out as. I thought that was excluded too.
Right, it was, and then we also kept that. So we didn't really issue a waiver within that order. We just kept that. So I guess you're right, but it is part of the waiver as well. Does that make sense?
Okay. Yep. Okay, and so all from our point of view, then every business, including the bed and breakfast, hotels, everything. We're good countywide now.
Yes, as long as they're willing to comply with the orders and they're creating and getting public health a plan so that we can get them a certificate of compliance.
Okay, that's the point. Good. Any comments?
I think it all sounds good. I'm looking forward to not having cases and getting back to business.
Yep. Okay, and then we'll look at this as a work in progress, right? A list of waiver status. We're going to roll as things happen. Then.
Absolutely, yeah. So we'll probably need to have another Board of Health meeting, possibly towards the end of next week or the first part of June, that first week of June, so that we can decide if we're happy with where we're at.
Yeah, we'll have to do that. We could consider it after the. Well, let's just see what happens here, but we could do it at the after the next Board of Commissioners meeting, perhaps on the 9th. So we'll see. Okay, let's move on then. Next order of business is the fair, and who's going to speak to the fair?
Meredith?
Is it Guinevere, Meredith?
So what I would suggest is that the fair in those representatives go first, and then the Recovery Operations Center can give their recommendation after that, if the chair would agree to that.
Yeah, that would be great. Go ahead. So who's representing the fair board? Would that be Debbie or?
Diane.
Diane.
I can't right now because I'm the one that's out in the wind looking at irrigation things. Go ahead,
Rhonda. Okay. Rhonda, do you want to speak it up?
Sure, I can read through the email that was sent out if they would like. I think the email I sent it to Alyssa, and I think she forwarded it to all the commissioners, so I think that they all have that. Is that correct?
Yes, I think Kip got it.
Okay, would you like me to read the whole thing, or did you have any questions about it, or anything?
I would read it so that the public can hear. Bulletize it if you want, paraphrasing.
Okay, let me pull it up. Give me just a second. Sorry, my computer is only slow when people are waiting on me.
And Diane Rose, if the wind dies down, feel free to comment where you can.
Okay, so we kind of drafted a proposal as to what the fair would look like this year. We did a Plan A, Plan B, and Plan C. And these are all based on what the county and state guidelines will be at that time. The first day of our fair is July. I think the shooting sports is the Friday before. So it is on July 10th would be the first day of fair. So for our indoor projects, what we did was for our Plan A would be it would be handled as previous years in a normal fashion, including interviews, projects being displayed during fair week, open entries, social distancing during interviews will be maintained. Our plan B for indoor projects is minimal contact. It would be like a drive-through, somewhat like what the school is doing. We would have judges here, but it would only be limited to extension staff, superintendents, and 3 judges. So, and what the kids would do is they would have a time to drop off their projects, just drive through the fairgrounds, drop them off, and then they can pick them up Monday evening or afternoon or Tuesday morning. And the indoor project building would be closed, but the judges would actually be able to see the projects in person and go through their record books. Our plan C for indoor projects is absolutely no contact. We will have the kids submit their record books and photos of their projects electronically, and we have already discussed this with the indoor project judges, and they are okay with that too. So we would still have judges. They would just be emailed the projects instead of having them in person, and no one would be at the fairgrounds at all. We also added on here that accommodations can be made in case it's Plan A, which is a somewhat normal fair. We have some kids that are immunocompromised, and we want to give them the option to do something besides Plan A if they do not feel comfortable coming to the fair at all. Okay, so that's the indoor project. For the animal projects, this includes horse, dogs, swine, sheep, goats, beef, rabbits, chickens, and llamas. Our Plan A is kind of the same. It would be in a normal fashion. Masks will be required. Social distancing must be maintained. Horse exhibitors may take off masks when they're on their horse. Hand sanitizing stations will be provided. The schedule will remain the same throughout the week. A large tent could be rented to provide an area that all shows and sale can be held outside in a spacious area, maintaining social distancing 6 feet away. Exhibitors and immediate family members will be the only ones allowed on the fairgrounds. So it should be way less than 250 people every day. Each family member will get a ticket on the day that they can be at the show. After each livestock show, livestock that will not sell will need to be removed, and if needed, a designated fair board member can feed for people that cannot be there on Friday. So that's the Plan A. Our Plan B is for minimal contact. All species will be held on different days, making it possible to show with minimal people and the judge. The horse members, there are 4 exhibitors. They can come to the fairgrounds, be 6 feet apart. They have to stay with their family unit and not socialize with other families. Masks will be required off the horse, but during classes may be removed, but only during the class. The judge will be required to wear a mask. Only exhibitors and immediate family members are allowed. Hand sanitizer available, and leave immediately after exhibitor has finished their classes. Dog members, there's 3 of them. They can come to the fairgrounds and remain 6 feet apart from each other or from other exhibitors and their families. Family units must stay together without socializing with other families. Masks will be required the whole time. Judge will be required to wear a mask. Only exhibitors, immediate family members are allowed. Hand sanitizer available. Sheep, we have 11 exhibitors. Goats, 6 exhibitors. Steers, 13. They could come to the fairgrounds, remain 6 feet apart. Family units stay together. Sorry, I'm trying to skim through and see if anything's different because it's kind of repetitive.
Brianna, this is Marlis. I was just going to skim through this. You know, the difference is this is a Friday, and all of them would be showing on the same day, but just at different times to space out the time frame that each set of exhibitors will be there. So there'll be the steers first, then sheep, and then goat exhibitors at different times, making an allowance for people to leave and come in without having a whole bunch of people there at the fairgrounds. So that's the biggest difference on the sheep, the goats, and the steers. You can continue. Sorry, Brianna.
Just a quick question. Thank you. Just hold on, just one quick one. Are there no pigs?
Yeah, we'll get to the swine. Sorry.
The next, okay.
Swine is held on a different day. Sorry.
Okay, go ahead.
So that was for the sheep, goats, and steers. The swine, there's 16 kids. They can come to the fairgrounds 6 feet apart. Only exhibitors and immediate family members. Hand sanitizer available. Exhibitors will come the day before to settle the pigs. Sale animals may stay to either get picked up by processor or used in the sale on Saturday, depending on the sale type. Designated fair board member will take care of the animals. Feeders, feed, water buckets must be left for the animals. Okay, rabbit and chicken members, there are 2 exhibitors. They can come to the fairgrounds, remain 6 feet apart. Family units stay together. Pretty much the same thing. Leave immediately after the show is finished. Llama, there's only 1. And same thing. Come to the fairgrounds, stay away from everybody, go home. Plan A or B for master showmanship. There's a maximum of 30 exhibitors, and it could be less than that. But it would be held on Friday at 4 p.m. There would be minimal contact, and they're required to wear masks. Before each exhibitor takes the animal, hand sanitizer must be used. Pig whips will be sanitized prior to each switch. Each group of kids will be able to prepare animal an hour before show. There will be no mingling after each show. Those exhibitors must leave after their show. Awards will be given out the next day in the junior, intermediate, and senior groups. Plan A or B for the bathroom will be limited to 1 person at a time. Paper towels, hand soap, and hand sanitizer will be provided, and will provide disinfectant for the person that uses the facility to clean all the surfaces after their use. Plan A or B on the livestock sale, we have 3 options that will be based on what the current guidelines are at the sale or during the sale time, which the sale should be on July 18th. So the livestock sale will be our plan 1. Livestock sale will be normal with sale on Saturday and meal following in large tent to maintain social distancing. Second plan, have a sale in the rodeo arena if the rodeo is canceled to provide social distancing. Or 3, have an online sale where videos are taken from the show day to use to sale on Saturday. So, and then plan C is a no contact virtual show for all members to submit video online for a judge to give an evaluation. And the animal kids all also have the option that accommodations will be made for them if they don't feel comfortable coming to the fairgrounds. They can submit their projects electronically. Okay, are there any questions on that, or you want me to just go right to shooting sports?
No, let me ask a question here, and then maybe there's some other people that might have one. So from an auction point of view, you had 3 or 4, 3 different kinds of plans. Is there a plan to have the sponsors bid remotely, or how's that going to be conducted? If they're, are they going to auction them in person or what?
This is Marlissa. So, based on those 3 options, all of the buyers will be invited. We usually have typically from 38 to 50 buyers. They'll be invited based on where we're at during that time. They'll be invited to either be able to come to the show if they feel comfortable, the sale, if they feel comfortable, or they can bid online or by phone. So in any of them, if we have to just do an online sale, then they'll be able to bid online or by phone.
Okay, that's good. And last question would be, what if all bets are off and the virus is defeated, and are you able to react and do everything normally, or are you going to hold to the plan?
I think I guess depending on when we're able to get the go-ahead, I think we can act on any of these, whatever is necessary, I guess. We just probably need about a 2-week to 3-week time frame to know for sure what we're going to do.
Yeah, that's good point. What we're looking for is what time frame do you have to plan it? So you think it's a week to 10 days before you react?
Yes. About 2 weeks. I think we can, as long as we are more forthcoming with the buyers and how, if we can offer these 3 options, and if they're able to be kind of fluid with us and the exhibitors and the parents, if we can do that, I think a 2-week time frame we would be able to get any of these done, pretty much.
Okay, good. Let's hold right here. Does anybody else have a question on what we've heard so far out there?
This is Jay. May I ask a question, please?
Go ahead, Jay.
Okay. First, I'd really commend you on this outstanding options that you've laid out, because no one really knows who it's going to be. My question is, A, B, or C is going to come into play when we find out prior to July 10th, as we get closer to that, what the situation is, what the public health nurse has told us we can do, and what the state has told us to do. And that's going to be the criteria on which plan you adopt. Is that correct?
Yes.
Right. You guys did a great job. Thank you.
Okay, one comment on that too. This is good. What you've read so far is excellent. Can you make sure that Kelly Camper gets a copy of everything we are discussing now, and what the next steps will be for shooting sports, etc.?
Yeah, I sent everything that I sent to you guys, I sent to Kelly as well.
Okay. Make sure she's got it. Okay, any other comments before we move on?
I have a few, but I'll just wait until the plans go about in full, and then I can bring in my recommendations.
Good. All right, go ahead with the shooting sports, I guess, is next, huh?
Yes. Okay, so shooting sports, which includes rifle, shotgun, and archery. Our Plan A shooting sports competition will be handled as in previous fairs in a normal fashion, but we will maintain a minimum of 6 feet between exhibitors for social distancing. Plan B, all shooting competitions that are held outside in open spaces. Masks can pose a safety hazard for shooting sports. Exhibitors will shoot one at a time or at a minimum of 10 feet apart, and only an immediate family will be allowed to spectate, and they must wear masks. And then our Plan C is no contact. Exhibitors will be asked to record a video of themselves shooting and submit photos of the targets electronically to be evaluated. And with shooting sports also, we will make accommodations if the kids don't feel comfortable coming to the fair at all, or doing Plan A or Plan B, then we will help them figure something out.
Good. Sounds good. Comment? Okay, is that wrapping up, or is it? Go ahead.
This is Meredith. If that wraps up the plan, then I can
say some recommendations that I have.
Go ahead, Mary.
Okay, first, well done. It's always good to have at least 2 options, so 3 is even better. I will say, in my opinion, I don't think option A will happen. One, because, we get this question a lot, and so I am sorry for asking it, but how will you ensure that those things will happen? So even if you have less amount of people and things like that, it'll be easier to make sure there's compliance within the plan if there's certain things in place. So I think Plan B within the options is more likely. And then this is all my recommendations come within the backdrop of if it's not stricter than what the state issues. I know there's going to be some guidances from the state soon regarding fair and rodeo and things like that, and so I will say all of that within the scope of, as long as it's not stricter than, and what the state is pushing out. And then a few questions. Again, you don't have to have an answer now. Yeah.
This is Tom. I'm sorry to interrupt. You said as long as it's not more restrictive. Do you mean less restrictive?
Yes.
Less restrictive, yeah. Okay.
Yes. Thank you. Yes, thank you. So, couple questions I have is, how will you ensure that everyone that comes in is wearing a face covering? So we are, again, this is a question that we get all the time, and so I understand. Will you deny access for people that aren't wearing a face covering? And or will you have options for if people don't have a face covering, you will provide one to them?
This is Marlissa. We talked about this. One of the other board members and I, Dr. Ingram, has ordered a bunch of face masks for any of the 4-H or FFA students or kids or exhibitors that want to come fair. She's already ordered some that could possibly cover anybody that doesn't have a face mask. The other thing is I do work for the PBR. They have offered to provide face masks for our 4-H and FFA county fairs as well. So we will require and deny access if that is what is required to do. Because we want everybody to be safe and we want everybody to have a good show, and so that we will require the face masks and deny entry.
Awesome. Yeah. I know that's kind of a hard decision, but I think it's a wise decision for sure. And then a main reason why I think option A won't be feasible is you're able to have a little bit more say in how much space is available for the people. And so it kind of gives a little bit less of a stress throughout the day to ensure that gatherings won't happen. And then also the idea of having the time slots for each exhibitor. Sorry, all this terminology, I didn't grow up in this arena, so pardon my slip on verbiage maybe. But so having that ability to have on different times or days will help you guys ensure that that spacing's happening. And then also my other question is, do you have roles and responsibilities listed out? So so the plan looks great, and then how to execute it. So do you have people, the manpower to ensure that these things will happen?
I am there. I don't want to talk out of turn, but I do believe that we have the manpower that can do it. We do have lots of, not lots, so we have a dedicated fair board that I think can be able to handle this.
Okay, cool. Yeah, as long as the roles and responsibilities of that is listed out so that we can ensure that those things are happening, that's good. Again, I think this is a great plan, a great thing. I think you've you guys have hit on a lot of the aspects that should be, and also ensuring that contingency plans are in place for sure. So, well done.
Thank you for your time.
Okay, real quick, Buck, are you there?
Sorry, he just logged into a different meeting.
Oh, he did. I know he was concerned at one point about the fair auctions and that kind of thing. Did he hear was he here for this presentation?
No, well, part of it, but most of it he did miss, and he just logged on for the task force meeting.
Okay. All right. Well, you can carry the flag for him then.
I will.
Okay, thanks. Okay, any other comments from the public? Questions? Okay, hearing none, it's rodeo time. Ron.
Oh, it's Alyssa. Sorry, I couldn't find my mute button.
Oh, go ahead.
So as public health, and Meredith and I are on the same page, and we have, we're a unified command, but I just want to say that I agree completely that B plan is the best option at this point. And again, I appreciate the people that did all of the work to put this plan together. So I really think it's important that we have a fair and that we do the best we can for our kids. So I appreciate that. Thank you, guys.
Yep, very good comments. Absolutely, it's critical for the kids in the county. Thank you, guys. Good job.
Yeah, Mr. Chair.
Go ahead, Tom.
Yeah, I hope the board members will have an opportunity here. I know you were asking for public comment, but we haven't had any as far as the board goes.
No, I'm sorry. Jake commented on the last one, and I thought that was the case. But go ahead, Tom. Comment.
Thank you. I certainly have some questions and some comments. One, I want to echo the congratulations. I served on the fair board for 27 years. Thank God I'm not on it this year. You guys have done an amazing job of coming up with this plan. So I think you'd be commended for that. I know where your hearts are, and that is to do whatever is right for these kids. So I appreciate that. So I've got some questions. I don't necessarily need answers now. They may be more food for thought, but just going down through there. I'm assuming all these plans, proposal plans, have been run by the respective leaders. I think that particularly of shooting sports, I'm assuming that that's been done. And then I would think, because I've seen the use on those bathrooms, I'm assuming you'll have a crew there to monitor those to make sure that's happening. And then I also wanted to just ask, and again, I don't need answers right now. It may take too much time. How's the situation on your livestock processors going? Are they going to be available? I hear probably not, but do you have a contingency plan there? Go ahead.
I can speak to that. Just so you guys know that right now we do have bids out, and that there are people that want to do the buyback on the hogs and the beef and the sheep and the goats. The processors on hogs have been taken care of. If the buyer buys it and wants to process it and have it custom, Elevations has offered to do some, and also we have availability at Fowler. I've already talked to them, and I just asked them, could you put us on the list as Custer County buyers, just in case anybody wants to use your facility, and they were more than happy to accommodate with hogs and sheep and goats. And the beef, as well, we have another processor that has come up and said that it's okay to put their names down in case buyers want to use them, but processors have been contacted, and I will get a list of those if you would like to see them, and I can get that out to you guys.
Okay, thank you. And then the sale you said is July 18th. I guess is general question. I'm assuming if the rodeo occurs, that'll be in the evening. So you may, you're thinking you may be able to work with the Saddle Club to have the sale out in the arena.
If it's still going on and or if it's canceled, that was just an option that we were thinking about asking and seeing if that's ability.
Okay, and then
so that's not been confirmed or denied right now. So
all right, that's fine. Then I see you said maybe you have your awards for your master showmanship on the following day. That would be on a Saturday. Is that correct?
Yeah, on the Saturday. Yeah.
Okay, like before the sale or whatever.
Yeah, and before the sale, in the junior, senior, and intermediate groups, if we have to separate them, in order to be able to give the awards in junior, intermediate, and senior groups, so that their parents can involved and we can provide social distancing.
Okay, and then I guess my really overarching question is, on each of the individual groups, can you select different plans, or are you going to go with plan A, B, or C for the entire fair?
I would guess that I guess that's something I can't answer. Brianna or Diane at this moment, because I don't know if we'd want to.
I would hope you'd have the flexibility to kind of pick and choose, because one glove may not fit everybody in this situation. So,
Yeah.
Because
right, and that's why we broke them up the way that we did. That's why we separated out the animals, the indoor project, and the shooting sports, because if we wanted even less people around or at the fair, we could modify any of the different categories, if you will, to make sure that we're compliant with the state and county guidelines at that time.
Right, okay. So I'm glad to hear that. There's some flexibility there, as I think there should be within the divisions. I don't think you can treat them all the same. And then, has the sale committee met and had input on your plans for your sale?
We've been in contact, and so everybody knows that there's the different options. And then I was a liaison to help, talk with you guys, and then I'll go back and give them the information.
Okay, all right. And obviously, number 2 under the sale, you would have a live auctioneer.
Yes.
Okay. And then I've got another question. I've saved it till last because it has a little bit of a negative connotation to it. I was told today I was not given any names, and I don't care. Names aren't important to me at this point. But I was told that an individual has said that if the Board of Health and the Public Health Agency doesn't allow the fair to occur, that the person's prepared to file a lawsuit. Is the Fair Board aware of those threats or not?
I have not heard anything of a lawsuit. Diane?
Yep. I said I've never heard of that before.
And I haven't heard of that either.
Well, I hope
Tom,
it's true, because it's
good
sure
point.
productive.
Yeah, that's true, Tom. It's good to bring it up. I can't imagine at this point, hearing what I've heard, that either Board of Health or Public Health Agency are anywhere even advocating canceling the fair. Sounds like.
I think that what we were going after even today is just to try to provide the best options that we could do to make it happen for the kids, and I think that everybody was positive moving forward with that.
Good. I'm encouraged to hear that. Thank you. Thanks, Mr. Chairman.
Thank you, Tom. All right, now time to move on to the rodeo. Ron?
Yep, we're here. Go ahead, George.
This is George Coons, Ron Becker, and Scott Bradley, representing the Saddle Club.
As well as rodeo committee. So, what are you looking for, folks?
Okay, so go ahead. You're here.
Has everybody involved, i.e., and Meredith, I did not send anything to you, Alyssa. I was kind of hoping that Meredith would share the coronavirus ground rules and safety guidelines with you. Did you get a copy of that?
I did, yeah. And I think it's a great start. And I have, I think, many questions about how it's going to be implemented. But yeah, I have a copy of them.
Great. I'm glad you did. And Jay, I wanted to ask, I know earlier you did not get that, and again, I apologize for that, but did you receive the copy that I did send?
I did, sir. Thanks for sending it.
Okay. And I understand because of the extensive length of that, you probably didn't get a chance to go through the whole thing, but hopefully you did get to peruse it. And Meredith, you brought up a good point. This is a great start, and that's exactly what this is. This is a start. And, you know, we got to start somewhere, and that's what we as a committee did. So going forward, let's do this, because I have read this extensively, and so has the rest of the board here. Why don't you guys shoot some questions? Let's try and take these things one at a time, and we'll just go from there.
I'm not in any position to do that.
Meredith, are you there?
Sorry, guys, I was talking to Shannon just a second.
Oh, it's okay. Did you hear my question? I'm sorry.
I didn't. Sorry, we just got our shipment of Relax 50 tests in, so we were talking about that. I'm sorry. Can you repeat your question?
Yes, absolutely. So you did get a chance to go through this document, is that correct?
I did, yes.
Very good. And at this point, I think the best thing that we can do, because we've gone through it ourselves pretty extensively as well, let's go ahead and start with the questions that you may have, and we'll just kind of go through those one by one, if that's okay with you.
Yeah, I guess that's up to the chairman.
Yeah, let me, I was thinking about that as you were talking, Ron. I think probably the best thing to do would be to have comments. I don't think anybody's prepared right now, Ron, to
oh, okay.
shoot some questions. I think it's something that as we evolve, and there's things are going to change, as you pointed out in our meeting, at the commissioners' meeting. You know, as we progress down toward the rodeo event itself, you know, people are going to have to be involved in what specifically your plans are in each area. And then at that time, give you comments and give approvals, actually, because the Board of Health and the Public Health Agency needs to be involved, but they need to see what they're involved with and how you're actually going to do it, because the DRC thing that I read is pretty broad. That was a lot of stuff, and I know some of that will be applicable and some won't be, depending on the specifics on what you're actually going to end up doing.
Okay. Well, you know, just to kind of get into this a little bit, I'm going to go ahead and let you know how eager we are for, you know, pro rodeo to return to its arenas. When you look at this comprehensive guideline that the PRCA has given us, I mean, that really does give us a baseline. So thank you for saying what you did, Meredith, because it really is quite extensive. But if we have the partnership with our local committees with our community health officials, medical experts, anybody and everybody within this community, I think this is absolutely feasible. I mean, this whole document is based in accordance with the CDC, OSHA, federal government recommendations. I mean, it is a roadmap that lays it out. And I think, go ahead. Somebody else?
That was feedback, Ron.
Oh, okay. So really what we're getting at here is, thank God we've at least got a good start. And that's what we're looking at. Who knows what this is going to look like in July, but if we start here and now with things like our health and medical screening, our social distancing and compartmentalizing, we start working with the local county and health departments. We start understanding exactly how we're going to work with our PRCA members and the mandatory screening that we're going to put them through. They're going to come through a separate entrance, how we're going to actually police all of our events, how the judges, our contract personnel, the rodeo secretary, how everybody's going to observe the safety guidelines that are set out. We're even looking at box office recommendations. Now, we don't have what we call an ABC plan at this time, but I think the best thing we can do with these safety guidelines is be able to start laying out for our Plan A and Plan A only, taking into consideration everything that could possibly happen at this event. And this document provides that guidance. I mean, one of the biggest things that we're going to make sure that people understand is our safety public message. I mean, we're going to have warnings right on the gates that people are going to enter this venue at their own risk. I mean, people are going to do what they're going to do. And I think, Alyssa, you brought it up earlier that, what can you do for people wearing masks or not wearing masks? What we're going to do as rodeo committee and people that are going to follow the guidelines in this as our committees, as our behind the arena, as our participants, we're going to follow this to the letter, to the best of our ability. And when we start, telling the general public that can come in and view this, we're going to let them know that as far as we're concerned, they're entering at their own risk, but by entering, they're also agreeing that they're accepting responsibility for their own personal safety and the safety of others by following all CDC recommended guidelines. And that includes social distancing. So, for us to be able to bring this to light and make sure that we're communicating in all areas from the entry gate right up to making sure that our announcer is consistently announcing, observe our distancing, just know that these things are in place. Make sure that the people that are supposed to be wearing masks are covering their mouth and nose, and ensuring that we've got hand sanitizing stations and cleaning personnel all over the place. As far as having those people in place, we don't have them yet, but we're going. Go ahead, Bill.
Yeah, Ron, I was going to suggest something here. You've done a good job of outlining the intent, and we've got a good guideline in the document that you have. I would suggest, and this is just to throw out to the board here, to Tom and Jay and to our health director too, is that the burden's on you. You need to, once you've made the decision, go, no go, and how you're going to go forward, then I would recommend you have a meeting time set up, if it's weekly, with the public health agency to show in stages, not bombard everybody with everything at once, what the plan is as you develop it. And if there is a reason to have a Board of Health scheduled meeting to make a decision on a yes or no, or go, no go on what's been proposed, then there's plenty of time to schedule that up. And we can have a meeting to approve, disapprove, that kind of thing as we get closer to the date of the rodeo. So that's only, if you think about it, from the 30th, that's only 6 weeks. That's maybe six meetings. But you need to have that act together and come to us, so with whatever the recommendations are. So maybe a skeleton plan like that you ought to present to us at some point.
Absolutely. And you said a couple of words there that I want to be real clear on. So the meeting that you're proposing, we're gonna have our go or no go, but you said the words approve or disapprove. Could you define that for us, please?
Well, you can't until you tell us, until you specifically say, here's our plan. You need to get a certain, in a sense, it's a certificate of approval, just like the businesses are required to have, that the Public Health Agency has reviewed it, and as you presented it, and specifically know what you're going to do in each case, or in a broad sense, if it's crowd control or whatever. You need to bring that forward, and if it complies with the expectations and the requirements and guidelines that Alyssa has, that we have, or if it requires a waiver of some kind, I don't know. It could. You may have some reason you want to change something a bit differently. Then that would be a requirement that would come before the board as a proposal.
Can I ask a question, please?
Go ahead, Jay.
Thank you. I heard the question slightly different than the way you answered it, but it's relevant anyway. Is the ultimate decision on whether the rodeo goes forward or not, is that with the rodeo board, or is that with the Board of Health, or the county, or is this with Public Health? Who will have the ultimate decision whether this goes forward or not?
That would probably, in my view, it would be contingent upon them meeting a requirement that the Public Health Agency has, and if it requires a decision to go, no go, that would be a Board of Health decision, I would think.
Okay, thank you.
So I have a couple of questions and comments, if I may.
Go ahead.
This may be directed more towards Alyssa than anybody else, but we're not going to treat this like it's a business, correct? This is a special event. It would fall under the guidelines governing special events, not businesses.
That's my understanding, yeah, that this would be considered a special event. I mean, I realize that it is a business and the Saddle Club is a business, but this is a special event sanctioned by the Saddle Club.
Well, Saddle Club's a not-for-profit organization, correct? So they're not a business, but they may conduct business, yeah. So I would think, yeah, we have to treat them as a special event. We can't lump them in and treat them like we do all the businesses, is my point. A question for the rodeo or the board of directors, are you at this point considering having a parade with the rodeo?
It's a possibility, but it's only a possibility at this point.
And a concert?
That's another possibility yet. It's not been determined yet.
Okay. And I want to play devil's advocate. What if the governor comes out or does not come out with an amendment to the orders that allows 250 people? What if he says that, no, we're not going to allow 250 people, maybe we have a flare-up or whatever? What do you anticipate doing then?
We'll go by the guidelines the governor puts out.
Yeah, again, we are in contact with the Cowboy Channel, so that's really one of the contingency plans that we're looking at. If we can get that group up here, because they do have the exclusive rights with the PRCA for televising these events, but if we can do that, I mean, the plan is, if we have to, close the gates to public observance, and let's contact all the businesses in town. Let's see if we can set up a large screen in some parks. Let's see what we can do to make sure that people can be in smaller groups, still visually watch these live events right in the same town they're in. Or if they want to stay at home, because as they say, you're safer at home, they can turn on the TV channel and watch the West Cliff Rodeo, Stampede Rodeo right there in the comfort of their own easy chair. I mean, that to me is going to be an option that we are trying to make happen. We don't want to be the epicenter of the COVID-19 return, but we're going to do everything we can to have a safe event and still have it open to the public. Again, we're going to use these guidelines. We'll be presenting as we go along our plans to make these happen to the best of our ability. And we'll just be working on some options that, hey, if we got to close our gates, you know, it's a private property, and we're still looking at hopefully going forward and having these contestants at least get some scores so they can qualify for the NFR.
Okay, another question. Has the board of directors given any thought to what you will do if Cheyenne cancels their rodeo?
And that's a great question. Yeah, we have talked to Tom, the CEO, up in Cheyenne. You know, they have 40,000 people from all around the world go to that event. And that's a whole different animal, as Tom said up there.
With respect, I'm just asking you, has the board had a discussion about what you will do if Cheyenne cancels? That's all I'm asking.
Yes.
And what was that discussion like? Do you care to share that?
That discussion was we'll make our decision on the 19th of June based on what they do.
Okay, thank you.
Ron, why don't you clarify that? What does that mean?
That means we're going to make our decision on the 19th of June whether Cheyenne Frontier Days goes forward or not. We'll make our own decision based on where we stand in this community.
Okay, that's what I want. Thanks. Anything else, Tom?
No, sir.
Okay, any other public comment? What you've heard?
Hey, this is Alyssa. I have a few. Oh, Alyssa, go ahead. No, Meredith, you go, and then if you don't cover what I have in mind, then I will.
Sorry, I'm balancing the Recovery Task Force meeting and this meeting, so I'm going to be quick in my comments. Right now, there's some things that I want to bring to focus is really nailing on how these things are going to happen. How is it going to be executed? So, especially the wellness checks. How are you going to ensure that those are happening? What manpower is going to do that? Public health only has 3 people, and I am just emergency management, and so we can't do that. And so, how we're going to be able to we can support in ideas, but I don't think we can support in manpower. Also, just as the fair had 3 plans, contingency plans, I think it would be very prudent for the rodeo to have contingency plans as well. I don't know what that would look like, but I think that would be a wise decision. And then I want to stress that no plan should be approved until it's actually written out. And I have skills in planning, so I'm happy to assist in that, but I cannot be the manpower in that. And I'm not saying that you're saying that, but I just want to stress that. I want to stress that again. So I think in real world, I don't know for July, to be honest. I think we can strive to try to make a thing happen, but I don't want it to be a surprise if it cannot happen. And I understand that it's a lot of resources and money for that, but just to be kind of real world, maybe rain on your parade might not happen. That's very blunt, and I understand the weight that statement has, especially for our community. However, I think we should just keep in mind that we are still functioning within a pandemic, even though we have these waivers in place, even though we're trying to open, while we open, that is increasing our risk as a community, and that is a risk that we're weighing, and we're trying to do the best that we can for the health and safety and economy. But again, come July, who knows what's going to happen between now and then, and I think it's wise to plan. But I would just also want to bring in a tinge of reality that it might not happen. And that's what I have to say in my comments.
Okay, Alyssa. Thanks, Meredith.
Yeah, I echo a lot of what Meredith said, and the rodeo committee knows exactly where I stand on all this. A couple of things that I want you guys to think about when you're making your plans is how you're going to deal with bathrooms, because even if we say we can have 250 people in 2 separate grandstands or whatever, all those people still have to use the same bathroom. My suggestion is going to be to have no vendors so that there's no issues with people standing in lines or gathering around vendor booths. And then the last thing that I'm thinking about is, it's a great idea to have the Cowboy Channel and have people around town, different places. That we're still then we're having an issue of who's gonna, police how many people are at those locations, so that we don't have too many people gathering at those locations. And if we can't have people in the stands, then how is that really going to help our local economy in the end? So I think we need to look at all those moving parts to decide if it's really worth having the rodeo at the end of the day. That's all I have for now.
Okay, good points. Those are things that we're going to wait with bated breath to hear the plans here, Ron. So, any questions from?
This is George.
George, go ahead.
I was glad to hear Alyssa's comments, and I agree with them. We would be looking towards the Board of Health for some guidance on how to do the temperature controls, and for primary check, and then a secondary check if necessary. But we would like the Board of Health to instruct our committee on how to do that.
Well, I would.
Yeah, George, I'm happy to help you with those plans for sure.
Yep. And also, George, the point that she made too is, there's only 3 people. You're going to have to come up with a workforce and be trained and help quote police it, or help quote give guidance, help take temperatures, whatever. You're going to have to, and I'm sure that's part of your master plan. I hope it is.
Yes, we would have a committee, but they would be under instruction, hopefully, of the Board of Health on how to do those checks.
Okay.
And remember, we just made the decision to move forward this week. So, we're still working with several individuals. We are looking for some outside help because, as Meredith said, we're limited on our people. So we are definitely looking at places like the Heart of the Rockies. We're talking to them about support. We are looking at, our pre-event screening, which is, the preparation just for the rodeo, having tents, having medical professionals in there to make sure we're doing that. We also have, during the rodeo, you've got your secondary health screening, you got your, personal screening. We've got procedures laid out, as you guys can see on page 21, 22, and 23 of the document that y'all have. So, your guidance is going to be imperative as our health department. And Alyssa, you did make a quick comment on how the rodeo board feels, but I would like you to please maybe publicly announce how you do feel about this rodeo as a board member, or as a ex-board member, as well as a rodeo committee member. Could you let us know your feelings on moving forward here?
Sure. So I am cautiously optimistic. I've said this before. I think that if we can raise the funds and not take funds away from other important projects in the community. And if we can work together to get all of the things that, all the little pieces like the bathrooms and the vendors and the blah, 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 ironed out, I think it's great. I mean, everybody knows or should know by now that I am highly invested in this rodeo. However, I'm more invested as a public health director in the health of this community. And so if there's any way that the rodeo is going to cause us to have an increase in cases in Custer County, then I'm not going to support it. That being said, if we can do it in a way that is healthy and maintains our low numbers up here, then I think we can go for it. There's going to be a lot of caveats to that to get to that point. So, thank you.
Thank you.
Okay, thanks, George. Thanks, Ron. Any other additional comments from anybody?
Yeah, we just had another alternate board member that just showed up. It is Barb Beckner, and she's come into the room. I think she has a public comment at this time.
Thank you. Hello, everyone. I did get some of the information of this last conversation there, and I just want to mention that, again, we just made the decision here recently, so we still have a lot of work ahead of us. However, the PRCA's guidelines is not just for Westcliff. This is throughout the country. So other PRCA rodeos are putting this into effect, and they are having rodeos. Our responsibility is to follow those guidelines, reach out to PRCA, other rodeo committees, which we will, and understand how are they putting it on. Try to find apples to apples, if you will. There's no reason why we can't be successful. It's just setting the guidelines, setting the volunteer crew with their responsibilities, and that's something we've always done and will continue to do. So if the guidelines are acceptable from what you see there, and they're very extensive, I would call this Plan C, then to me that's a go if we do follow this to the T. If the rules are lessened by July, by the state, by the county, well, then that's a no-brainer. There's things that would be lessened up, which the health department would be advising us, I would assume.
Thank you.
Thank you.
Yep, appreciate that, and that's a very good point. It's an army. It takes a team to make it happen, and the team is, from what I'm hearing, is the entire county is involved and will be involved. And if we can pull it off, it'll be a great thing. So, thanks for your comments.
Thank you.
All right. I think unless we have some other items, did we cover everything that we need to cover? I'll ask the board that. Jay, are you happy with where we are now?
I am, but I'd still like to bring back the question of enforcement of violations of the orders. Just me speak. Yeah, hang on. This is just me speaking now. This is involved with writing the orders. I look at that as the executive branch of this government that we have now. The executive branch is the one that should be enforcing it. That's where we have separation of powers. I'm having some trouble understanding why Alyssa is the one who would be writing summonses. I think it's fine for her to write the letters and tell people they're in violation, but if it comes down to enforcement, I think that's a law enforcement issue. I just don't understand how that's operating at this point.
Well, that's a good question, and it's my understanding that the boards of health in all states are accountable for that action, either a fine or jail time. And what are you proposing, Jay?
Well,
Seems like
what I've heard from other counties is most of them, the Board of Health or the public health officer tells the law enforcement agency of the community about the violation, who then takes the police action. Kind of like the public health nurse would be a deputy, but an unsworn deputy who can report an incident where the police department then would handle the enforcement of the incident. I'm just concerned that Alyssa, I don't feel comfortable with Alyssa being the enforcement agent. If that's the way it is, that's the way it is. I'm just not comfortable with it.
well, the public health agency is accountable for it being recognized as an enforceable action, and the ticket that's isn't the ticket that's written is by that department. Isn't the court system take it from there? The action that would follow, either collecting a fine or a jail time. I mean, Alyssa's not going to do that.
Can I jump in here, gentlemen?
Yeah, I was going to ask Clint. Are you there, Clint?
I am.
Go ahead.
All right, well, here's my position on this. Alyssa could issue a citation. She has the paperwork and everything to do that, and the sheriff's deputy would accompany her if she was going to, but after having studied this and given it some thought, there's two ways to proceed. You can proceed through a criminal action or through a civil action, and I think we should forget about criminalizing or trying to go that way. If somebody is absolutely adamant that they're going to ignore the public health order, then it's my job as the attorney to get a restraining order or a temporary injunction from the court right away to order whoever we're talking about, a business owner or something, to order them to comply and go that route. So that would be my recommendation of how we do it, that if she's got somebody that absolutely won't listen to reason, then she talks to me and I take immediate legal action as quickly as I can, but I would do it as a civil action, not as a criminal matter.
That's where I was. I'm just speaking to it. That's a good point. I'm glad you brought it up. Jay, does that meet the criteria?
Yeah, I mean, it's okay. I think if someone violates an ordinance or a law, that's more criminal than it is civil, but I absolutely trust counsel, and if he feels comfortable with it, I'm fine.
Well, I'll tell you, the public health laws, they have criminal provisions for the state health agency, but when you get down to the local level, they also do have a statute that provides a criminal provision. It declares it to be a Class 1 misdemeanor to violate a public health order, but I would personally prefer that we do it through a civil proceeding rather than a criminal proceeding.
I'm fine with that, sir.
Yeah, and I would be too. Tom? Comment?
Yeah, no input on this, Bill, thanks.
Okay.
And the reason for doing that would be that even if Alyssa issues a citation to somebody, the court date doesn't come up for 6 weeks or 2 months down the road, and that's just for a first appearance. That doesn't stop the violation.
Right, I understand that.
I got a quick question.
Go ahead.
It looks like we're getting orders from the governor, and my question is this: Are these orders a law?
There is violation of a public health order has been declared by the State General Assembly as a law. So, I mean, those are valid laws that can be enforced. But there's a whole lot of there's a whole lot of debate about some of this, but it's in the statute. The legislature, the General Assembly, declared it to be a criminal violation in certain instances to violate a public health order.
Great, thank you. That's something that's been on my mind, so I'm glad you answered that. Thank you.
You're welcome.
And Ron, just to follow up, if you look at it, that's why there's an awful lot of guidance and recommendations from the governor, because this isn't covered by legislative action. And in some cases, in some states, some of the legislative actions are not necessarily constitutional, and that would go even further. So, you could debate that all the way. So we're treating the orders as orders for now, and we'll let the constitutionality of it be ironed out in court if it ever comes up.
Yeah, very good. Thank you.
Okay, any other comments from anybody?
This is Alyssa, Mr. Chairman.
Alyssa?
Yeah. So I just want to be clear. So going forward, I sent out, like I said, 5 letters today. So if those people continue to not comply, Clint, you want me just to get a hold of you and we can deal with it from there?
Yeah, let's do it that way. If you've got somebody who's absolutely ignoring you, then talk to me first. I mean, you still have the authority to issue a citation, but let's talk about it on a case-by-case basis.
Okay, sounds good. Thank you.
All right.
All right, any other comments?
Mr. Chairman, this is Ashley Franklin.
Go ahead, Ashley.
Hey, we were talking to Alyssa today about the 4th of July parade, and so I didn't know if this would be the venue to possibly bring it up. Or Alyssa, if you have any words that you want to say about it, or if we maybe just kind of need to give a history of what's going on and what we hope to see.
Mr. Chairman, this is Alyssa. Yeah, thank you. Okay, so I did some research, and Ashley, I'm glad you piped up here. Thank you. I did some research, talked to the surrounding counties, and they are allowing parades if people will either stay in their vehicle or gather in groups of 10 or less, maintaining social distance of 6 feet. Of course, like family groups can stay closer than that, of course. So I will make that my suggestion from public health that we can do that up here as well. However, I think just like the same, it should be considered an event, and we should get those plans probably in writing from the organizations that are putting on the parade, including like how are you going to ensure that people stay 6 feet away from each other or in 10, groups of 10, and who will be responsible for, quote, policing that or ensuring that happens. So that's my take on it for right now. I would be interested to hear what the board thinks about that. Thanks.
Just a quick comment, Alyssa, just came to my mind as you mentioned groups of 10. Are events limited to 10 people 6 feet apart from each other and then another group of 10 somewhere else? How's that handled?
At this point, that's how we're handling it, based on the variance that we got. And again, this is why this whole entire situation is so frustrating, because why should we let churches meet with groups of 10 people, but we can't have groups of 10 people, in a restaurant or on a parade route? So I think if we can do groups of 10 people, we'll be most in compliance with the order at this point. Again, on Tuesday next week, that will probably change. I have no idea what that's going to look like at this point. So we're still in the wait and see pattern on that as well. I think that some of that will be lifted. The stringency will be less. But I'm also seeing that the plateau that we were seeing is diminished, and so I think that with that data the governor's going to be less apt to open things up quite as much as we are hoping for. So, thank you.
Yep, good point. We're going to have to wait and see a little bit on that one. And then we got to wait for the 4th of July sponsors to come up with a plan that we can look at. A little premature yet.
Yeah, and that's something we can definitely work on, and we're really optimistic just because the parade does go almost an entire mile. I mean, if we need to push it down to the bluff or come around the corner by the bank just to make it a little bit longer, I mean, that's something that we can do very easily without recreating the wheel. Because basically, Tracy and I just met with the Sentinel and took everything over. They were kind enough to give us the documents and whatnot, so we've updated all of those. We did put a little COVID paragraph in, so we are trying to be as proactive as possible for like the participants that they'll have to sign off on the waiver for their entry. So we just want to work with you guys and make it a successful event because we know that Custer County needs the revenue, the townships need the revenue. We need to be safe, but we also need to provide the citizens something fun, especially with everything going on. So we just want to be a part of it and make it successful.
I have a question, Ms. Feldman.
Go ahead, Tom.
Thank you. It's for Ashley. What organization is sponsoring this parade?
Myself and Tracy Ballard, we purchased an insurance policy to protect ourselves with the township of West Cliff and Silver Cliff, and we can also add on State Patrol and Sheriff. Kurt has also purchased an insurance policy to protect the township, the Sheriff's Department, and State Patrol.
So I understand it's you and Tracy are actually heading it up. Is that correct?
Yes, sir.
Okay, thank you.
Uh-huh.
All right. Good discussions, good meeting. Any other comments? All right. Do I hear a motion to adjourn?
So moved.
I'll second.
All right. It's been moved and second to adjourn. Any comments? Any discussion?
No discussion on adjournment, sir.
All right. So we can adjourn. Let's go. Thanks.